Hello, welcome to Crack the Boards. This channel is dedicated to helping you excel in the USMLE by offering over 2,000 questions, complete with answers, detailed explanations, and the rationale to deepen your understanding. So be sure to subscribe, like, and share to support the channel and stay updated on the latest content. In today's video, we will focus on USMLE questions related to microbiology. Let's have a look at the first question. A 36-year-old farmer from New Mexico is brought to the emergency room unconscious. According to his sister, he was healthy until 3 days ago when he developed severe flu-like symptoms that prevented him from working, particularly cleaning out an old barn. A chest X-ray reveals interstitial infiltrates, and within 24 hours, he passes away. An autopsy reveals pulmonary edema. Which of the following agents is the most likely cause of his condition? A. Brucella suis, B. Coxiella burnetii, C. Hantavirus, D. Legionella pneumophila, E. Nocardia asteroides. The correct answer is C. Hantavirus. The clinical, laboratory, and X-ray findings are consistent with the diagnosis of hantavirus pulmonary syndrome. This disease is caused by a hantavirus whose reservoirs are rodent saliva, feces, and urine, and is acquired via contact with such. Hantavirus pulmonary syndrome causes a febrile illness with flu-like symptoms and bilateral pulmonary interstitial edema. Let's have a look at why the other options are incorrect. Option A is incorrect because Brucella suis is usually acquired via contact with the contaminated meat or dairy products from infected livestock. Brucellosis has an insidious onset and course. Signs and symptoms of brucellosis are similar to those of tuberculosis and include fever, night sweats, and weight loss that continue for months. Option B is incorrect because Q fever, which is also known as quarry fever, is caused by Coxiella burnetii and is usually acquired via contact with the infected tissues or body fluids of sheep, goats, cattle, or cats. Q fever has a more insidious onset and rarely follows the fulminant and fatal course described in this patient. Option D is incorrect as Legionella pneumophila causes Legionnaire's disease and Pontiac fever. Either of these diseases can have a sudden onset, and Legionnaire's disease can run a fulminant course. The infection is usually acquired via inhalation of contaminated aerosols or mists, and affected individuals are usually older than 50 years of age. Option E is incorrect, as Nocardia asteroides is an opportunistic pathogen that usually affects severely immunocompromised patients such as those with cancer or AIDS. Although the organism produces pulmonary disease, it has an insidious course and rarely affects immunocompetent individuals. Let's have a look at the second question. A 9-year-old girl who recently moved to the United Kingdom from Southeast Asia is assessed for joint and back pain. An MRI shows a destructive lesion in her lumbar spine, while a purified protein derivative test reveals a 25 millimeter in duration. Her chest X-ray displays multiple calcified granulomatous lesions. What condition should be suspected? A. Ankylosing spondylitis. B. Immune-mediated osteoarthritis. C. Pott's disease. D. Reactive arthritis. E. Salmonella osteomyelitis. The correct answer is C. Pott's disease. This patient has tuberculosis of the spine, commonly known as Pott's disease. Children from countries endemic for tuberculosis may sometimes present with extrapulmonary manifestations of the disease. Let's have a look at why the other options are incorrect. Option A is incorrect, as ankylosing spondylitis is a chronic inflammatory disease of the spine that presents with back pain radiating down to the thighs and stiffness in the spine. There is a genetic predisposition involving HLA-B27, and the onset is usually around 20 years of age. Option B is incorrect, as osteoarthritis is a common degenerative arthropathy that typically develops in weight-bearing joints without systemic manifestations. Radiographic findings include narrow joint spaces, increased subchondral density, and bone cysts. It typically presents in elderly individuals and is unlikely to be the cause of the patient's joint and back pains. Option D is incorrect, as reactive arthritis typically develops following a sexually transmitted infection or a diarrheal disease caused by enteric pathogens such as Campylobacter jejuni, Shigella, Salmonella, or Yersinia enterocoliticea. And up to 80% of the patients have HLA-B27. Option E is incorrect, as Salmonella is a common cause of osteomyelitis in patients with sickle cell disease. There is no evidence of either of these diseases in this patient. Let's have a look at the third question. A 20-year-old lab technician visits the clinic with joint pain and eye redness. She mentions experiencing diarrhea, fever, and abdominal pain about 5 weeks earlier. A stool culture after 48 hours revealed a motile, spiral-shaped microaerophilic bacterium with corkscrew motion. Which bacterium is most likely responsible for her symptoms? A. Campylobacter jejuni. B. Helicobacter pylori. C. Salmonella enterica, D. Shigella soni, E. Yersinia enterocolitica. The correct answer is A. Campylobacter jejuni. The microaerophilic, spiral-shaped bacterium with corkscrew motion is most likely Campylobacter jejuni. Campylobacteriosis has been associated with two major post-infection sequelae, such as Guillain-Barré and reactive arthritis. Reactive arthritis presents with a triad of urethritis, conjunctivitis or uveitis, and arthritis. The triad can be remembered with the mnemonic as can't see, can't pee, can't climb a tree. Let's have a look at why the other options are incorrect. Option B is incorrect, as Helicobacter pylori infection may result in peptic ulcer disease, but not infectious diarrhea. Although morphologically the bacterium is similar to Campylobacter jejuni and also requires microaerophilic conditions, it is not known to be associated with reactive arthritis. Option C is incorrect. Although Salmonella enterica has also been associated with reactive arthritis, the morphological description of the isolate does not match the characteristics of Salmonella organism, which are rod-shaped and do not require microaerophilic conditions for optimal growth. Option D is incorrect, as Shigella soni is another enteric pathogen that can trigger reactive arthritis. However, the bacterium is rod-shaped and non-motile and does not require microaerophilic conditions for optimal growth. Option E is incorrect, as Yersinia enterocolitica infection has also been associated with reactive arthritis as a post-infectious sequela. However, the bacterium is rod-shaped and does not require microaerophilic conditions for optimal growth. This concludes today's set of questions. Thank you for watching today's video. If you enjoyed it, please don't forget to subscribe to support the channel and stay updated on the latest content.